My name is Dr. Jeff Blank, and today I'm going to be demonstrating a simplified veneer technique with Artiste Composite by Pentron Clinical Technologies. Obviously going to be working on a typodont tooth using Bond 1, which is Pentron's 5th generation single bottle adhesive. It's applied, obviously air thinned, and of course light cured. And in real life, of course, you'll be etching. I'm going to begin with the dentin body shade of this material, and this is going to be A2. Now normally when I'm not doing a technique case, I would apply it all over the tooth in a general full coverage tooth situation. But what I'm going to do here for demonstration purposes is I'm going to build out the cervical 1/3 and make it the most facially prominent aspect of this direct veneer. What we're going to be doing, of course, is light curing that, bringing that to full contour in the gingival 1/3, and then we're going to be applying a second layer over the incisal 2/3. Now, the unique thing about this is we're going to be actually tapering this back so that we can leave room for an enamel overlay to give us translucency and vitality. I'm going to obviously shape this, and I'm going to be using, this is an Optroscope by Ivoclar Vivadent. I'm going to be shaping this and tapering the two layers and blending them together with that silicone tipped instrument. And I'm going to be shaping what we call dentin mamelons in the incisal 2/3. The excess is obviously going to be removed from the distal, and as you can see, creating good dentin outline, and it's through these notches that the dark oral cavity is going to pass through, the light's going to pass through and create incisal edge effects. See how the gingival 1/3 is the most facially prominent, and then I've tapered back the incisal 2/3, and that's going to leave room for an enamel overlay. Well, here we use the A enamel, which corresponds with the A2 body shade that we used, and it's going to be only applied to the incisal 2/3, and that way we actually get a desaturation of that dentin color as we approach the incisal edge. Again, the silicone tipped instruments to refine anatomy, very helpful and easy to use. As you can see now, we're looking at the various angles, and obviously all that's left at this point is to go ahead and light cure this, and then we're going to be applying an incisal halo. Pentron with Artiste has made milky white, which is a frosty kind of white colored where we can put a little frame or halo on the tooth. Just kind of gives it that really vital look that you see in natural teeth and ceramics. It's adapted with that Optroscope instrument, obviously just applied right to the edge like a window pane, and then of course smoothed and adapted and blended on the lingual aspect. Don't want any voids back here. Chips and fractures would be a big problem. And then that's light cured. I like to use these are finishing burrs by Comet. We have various flutes from 10 all the way up to 20 fluted burrs, and we've got egg-shaped type burrs that we can work on the back. Again, Comet, K-O-M-E-T, very good company that really has a lot of nice finishing instruments that I really like to use. This is Enhance by Dentsply Caulk, good for shaping, developing facial anatomy. And then we'll go through the Composite system with blue and pink cups, and what we're dealing with is getting up to a final shine with Ultradent Diamond Polishing Paste on a wheel that we use to buff. The nanos are very dense materials, and I find that they polish more like ceramics, so I use ceramic finishing systems like this to really snap out that shine. What we're going to do is get a final look at what we're looking for, and look at the incisal edge translucency you're going to see here in just a second. Obviously seeing good, nice halo. You see the mamelons created that translucency, good desaturation, nice shine, excellent material that we see here with the Pentron Artiste Composite.